Hi, this is Paul Reich, the Behavioral Health Program Manager at Tri-County Health Network, and I'm joined here by my colleague Corinne Cavendar, our Behavioral Health Operations Coordinator. Welcome to our first Mental Health Matters Access show here on KOTO. We'll be hosting these shows every month on KOTO to highlight resources and programs available in our community around mental health, and we're excited to have you here today. Thank you to the KOTO News Department and Ben Kerr here at KOTO for making this possible. Corinne, who's our first interview with today?
For our first segment of Mental Health Matters, we are joined by Robin Slater from the San Miguel Sheriff's Office. Thanks for being here, Robin.
Thank you for having me, Corinne.
So first, why don't you start off by telling us a little bit about yourself?
Sure. My name is Robin Slater, and I have 35 years of experience working for grassroots nonprofit organizations. Early on, I was the director of a Boys and Girls Club in Southern California, and then relocated to Colorado, where I started work for Governor Romer's Communities for a Drug-Free Colorado. After that, I was hired as a fundraiser director for United Way of Mesa County, and really realized I wanted to provide more direct services to the individual who were in need. So I went to school and got my master's and worked for St. Mary's Hospital, helped open Colorado West, which is a psychiatric hospital in Grand Junction. And then most recently, I had the honor and privilege of working for the Center for Mental Health as their director for acute services. I'm a licensed professional counselor and also a licensed addictions counselor.
Wow, Robin, that is a vast resume. So we're so lucky to have you in San Miguel County. And the reason we have you here today is to learn more about the co-responder model that's run out of the Sheriff's Office. Can you explain what that is for our listeners?
Sure. So back in March, the San Miguel Sheriff's Office had asked if I would be their co-responder behavioral health clinician. And the cool thing about a co-responder is that we work in tandem with different law enforcement agencies, fire department, our Telluride Medical Center. And so when an individual is in crisis, instead of the stigma of having a mental health issue or substance abuse issues, they call a behavioral health specialist, myself or Lauren Oliver, who I am so pleased that 1A was able to provide us funding. So we're able to offer this service 24/7, 7 days a week. So an individual can access behavioral health services immediately when they're in crisis.
That's amazing, Robin. We're so lucky again to have that kind of thing in our community. So for someone who's interested in calling for a co-responder, if they're in a crisis or see someone who's in a crisis, how do they get the co-responder to come? How do they access that type of service?
That's a great question, because a lot of people really don't know how to access services. So there's really no wrong door, to be honest with you. Okay, so that's number one. If they are in crisis and they call any number, but let me throw out a couple of numbers where you can just really immediately get that access. So first is by calling the San Miguel Dispatch, which is 970-728-1911. Or Colorado Crisis Line, which is 1-844-493-TALK, or 8255. And also you can call the Crisis Walk-In Center in Montrose that's managed by the Center for Mental Health, and that number is 970-252-6220.
Amazing, thank you. Yeah, I think that's super important for people to understand that they have the ability to access a co-responder.
And we'll repeat those numbers at the end of the show as well. So we'll have those numbers again at the end. Robin, you probably don't remember, but I had occasion to actually use the services of the co-responder. I had a community member call concerned about someone, and so I immediately thought of the co-responder, and I was able to call. I have an inside number, so I was able to get a hold of Robin directly. But I was really impressed with how it unfolded. And I don't know all the details, but I know you were able to respond and help the individual. So I've seen it work. It's really neat.
Oh, thank you. And I have been amazed at the positive response that we've had with the individuals that we've worked with. And able to link people with the right service. But I also think reducing the number of individuals who are incarcerated for low-level crimes secondary to mental health issues and substance abuse issues. And so when you really take a look at the program, you know, being able to meet that individual where they're at, to collaborate with a group of peace officers, Telluride Medical Center, physicians, social services, and able to give the individual the type of services that they need, to me, that is where it's at. That's huge. So thanks, Paul.
Robin, do you think you could give us an example of, you know, maybe a made-up example, obviously, because we don't want to give anything away, but of what it would look like if someone called a co-responder? So let's say I saw someone in crisis and I called one of those numbers that you gave. What would happen next?
Sure. So what happens next is, so if law enforcement isn't necessarily needed, so for instance, let's say this individual is just struggling with some substance use, having thoughts of harm to self, they can call the dispatch. As long as the environment's safe, then we actually do a mobile crisis response. So we don't always do it in tandem with a peace officer, but also we do consult with the peace officer to make sure that the safety of the co-responder and the individual, you know, that's always first and foremost. One of the most exciting cases we were instrumental in helping is a young lady who needed to actually get to a family member in Durango, and so one of the peace officers and I were able to transport and meet in Dutton one of her family members, so she was able to get home where she needed to go. Another example is a homeless individual who ended up at medical center, and we were able to provide housing and then getting a bus ticket to get back to their home after being actually stranded here after Fire Festival. So we actually not only do crisis assessments and case management, but we also try to help individuals reach their overarching goals and get them home where they're going to be able to receive the support and care that they need in a long-term situation.
That is so amazing and an incredible opportunity again.
Yeah, I can hear your enthusiasm in your voice. You know, Corinne and I are both mental health first aid instructors in Safe Talk, and so we often in those courses we tell people that, you know, you can to call 911, to call law enforcement, but there's always that reticence. I mean, you hear the stories in the national news about the fear of involving law enforcement. I mean, this sounds like a really good workaround at the local level to help people, you know, without necessarily involving law enforcement in the problem resolution. So that's cool.
Yeah.
That's neat.
Thank you. And sometimes, you know, one thing, Paul, that we also do is, so let's say it's a domestic violence situation and one of the individuals has alcohol. So what we do is we stage down with a peace officer. We decide what is the safest approach. And oftentimes, you know, just the presence of a peace officer will escalate a situation and actually put more people at risk or harm. So we're able to collaborate, come up with a safe, and then they send the co-responder in, and we have had some pretty amazing results. And what happens is that individual who is in crisis feels like they've gotten their needs met and they continue with seeking services and care. Because oftentimes people with mental health issues and substance abuse issues, it's not just going to be one crisis. They have to rely on a complete system of care. So we also collaborate with local agencies and therapists to ensure that individuals have a good continuity of care to pursue their goals of a more healthy lifestyle.
Wow.
Yeah.
Kind of to build off of that, Robin, and you've touched on this a lot, but can you explain how you think this type of program benefits the overall behavioral health of our community?
Sure. So again, I think when people feel that there is a safe vehicle in which to receive services, they're going to be more apt to reach out. And so when individuals are having thoughts of suicide, for instance, oftentimes a peace officer would show up at the door, right? And even though that person, maybe the peace officer doesn't talk about the person, they're HIPAA. Everybody in that community, let's say the VCA, knows something's going down. And so right off the bat, there's the stigma of reaching out for help. So I think the biggest benefit is that we're able to send a behavioral health clinician in. We are not in uniform. We do have now transport vehicles. So in the past, Corinne, individuals with mental health issues were handcuffed because of safety precautions and taken to a facility. Now we have secure vehicles, and so the behavioral health clinician can actually take that individual to the crisis walk-in center in Montrose without that stigma. So think about how that feels for that individual in crisis and individuals who know of other individuals detox or substance use treatment. They're more apt to contact us and not spiral down and do something to take their own life. And we've seen that way too often, that our system just feels punitive versus welcoming. And so I think our program is really that. It really welcomes the opportunity for people to get the help that is most needed.
Within the program itself, it's destigmatizing accessing mental health and behavioral health services.
Exactly.
That's amazing.
Yeah, if I didn't know better, I'd say you guys had a crystal ball with starting this program in March with everything that our community has experienced since March with COVID-19. And you know, I know one of the things we're curious about is, you know, kind of numbers of how many people have you served, but what have you seen? I mean, have you seen a worsening situation in among community members as a result of the isolation and the stresses of COVID-19?
Yeah, so, you know, Paul, that's a really great question because, you know, I joke, you know, alcohol sales went up 54% in that first month, right? And so that right there tells you a lot. And that oftentimes, you know, in that isolation, we don't get the support and comfort that we have by the individuals that we used to receive it from. And so we have seen a lot more depression, anxiety because fear of the unknown. Individuals aren't able to go to work, children aren't able to go to school. So we have seen an increase in the number of individuals that we've outreached. We have had over 100 co-responses and or responses, but we also have individuals that we do long-term case management. So we're right there on the sidelines waiting for them to become ready for treatment. And, you know, I just had an exciting case where I've been working with somebody for months, and they finally decided that they were ready to go toxin some treatment. And so again, you know, I work very closely with the fire chief in Norwood, and he is amazing, John Bockrath, and we reach out to individuals and we meet people where they're at, and we just hold a safe place until they're ready. And so yes, Paul, we have definitely seen an increase in the numbers, and then the type of individuals that we're seeing tend to have a lot more acute substance use issues right now.
Yeah. Yeah, thank you for, I mean, certainly, and we've seen, you know, marijuana, cannabis sales at record levels in Colorado. So we know there's a lot of self-coping or treating themselves going on. And of course, you know, you're covering the whole county, right? So you're all the way out to the Utah line potentially, as well as in the eastern end.
Yes, absolutely. And that's one thing that's great about this program as well, and having our own transport vehicles, but again, in collaboration with other agencies to be able to respond in a very trauma-informed way. And so, you know, part of the goal of this program is also to educate and train peace officers and other community members to be able to provide that response. And what we're seeing is, you know, it's almost contagious. Once you start responding in this trauma-informed way, people are accepting, they want treatment, it makes you want to continue to do it even more.
Robin, we're really fortunate to have this co-responder model in our community, but is there anything happening across the state with co-responder models?
Oh yeah, so the co-responder model is really not new, and they all look a little different. One of my favorite co-responder models actually has a behavioral health clinician, an EMT, and a peace officer that responds on scene to all events, so that individual can get the medical care maybe that they need in addition to the mental health And then also peace officers are typically utilized more for safety precaution than anything. And so the more that peace officers kind of back out of that equation, what we've noticed is more people are starting to access the mobile crisis response philosophy. And that is where we meet you where the crisis is occurring. So if the crisis is occurring at Wilkerson Library, we go to Wilkerson, have a safe environment, very confidential place where we can do an appropriate assessment, collaborate with you, level of care, and then we can actually do the transport to the level of care that's most indicated. Mm-hmm. And so there's a variety of different mobile crisis and co-responder models out there. And they all seem to be really effective, Corinne, in reducing the number of individuals that are incarcerated, and in addition, the number of calls for peace officer response. Oftentimes, like I said, the behavioral health clinician can respond in lieu of the peace officer.
Interesting. And you also work with the law enforcement officers as well. I mean, the peace officers. You also provide assistance to them as they process, perhaps a bad call or a difficult situation. So.
Absolutely. And Paul, one thing that's great is we have an amazing search and rescue here in San Miguel County as well. I have volunteered to be on search and rescue. So when we do have events that occur, I'm there for the team and also there for other individuals who may be witnesses or have also experienced that trauma. So I am trauma trained in eye movement desensitization reprocessing, also known as EMDR. And so we are also available to law enforcement, peace officers, EMTs, search and rescue, to be able to support them in their efforts as well.
And Robin, as we wrap up, is there just anything else you want people to know about this program?
I just want you to know that this is a huge collaboration among a lot of individuals in San Miguel. And again, I briefly mentioned about the 1A dollars providing some financial support to ensure 24/7, 7-day-a-week coverage. But this is a real community effort, and I am just so honored to work with a community like San Miguel, who really does care about the constituents. And Tri-County has been one of the leaders in ensuring that these services continue, and also offering their telehealth services. It's a nice way for us to hand off. So I'm really honored to be able to work again with such a great group. It's amazing. So thank you.
Thank you, Robin, and thank you for joining us today. If you or someone you know is experiencing a mental health emergency, please call the Colorado Crisis Service Line at 1-844-493-TALK or text TALK to 38255. As Robin said, if you are in San Miguel County, you can also contact the Sheriff's Dispatch Office at 728-1911. Join us on January 20th for our next edition of Mental Health Matters. If you are interested in learning more about our behavioral health programs at Tri-County Health Network, please email us at info@tchnetwork.org or call our offices at 970-708-7096.